Very good evening, friends. A very warm welcome to all of you on this Materia Medica session. And today we're going to learn very important remedy from third year syllabus as well as from practical point of view. That is selenium, a metal. We're going to learn both the aspects, the clinical aspects of it. I have two cases to share with you. One was very interesting. I think I have shared that case when earlier also I have taught this remedy somewhere else. I could not recollect it, but that was an interesting phenomenon. One day, it was way back, nearly about 7-8 years back, one fellow, 52 years of age, by profession, a teacher who came to me in a very depressed mood. And when he sat in front of me, he said, "Doctor, I want to take your treatment for one of the important problem, but please don't allow anyone to sit over here." There were my student 2-3 which were there along with me. So they left the room, and this fellow all of a sudden started weeping. In a very sad mood he was there, and he started telling me, "Doctor, I am suffering from very severe sexual problem." So I asked, "What's the problem?" He said that I am having impotency since last 2-3 years, and I have tried many treatments. I went to the sexologist, I went to the psychiatrist, I went to the physicians. Many people I have shown, I have taken Ayurvedic treatment, all of them, but nothing worked. And today there was a big fight between myself and my wife. And she said that I'm leaving this house. Actually, I was taking the treatment, and that's why I was not going anywhere. She said that either you go to the another specialist, or either you take the treatment, otherwise you will not going to satisfy me, and I'm leaving. And he was in a very bad, very sad mood. Already he had a young daughter and young son in the house. And he said, "Doctor, see what's happening in my life. I have absolutely lost the hopes now. But someone told me your name 3-4 days back, and he promised me that you're going to definitely will work for me and give me the result. And that's why I'm here." And he told the history that it is happening since last 2-3 years. Earlier, it was not so strong. Many doctors, they have done many investigations, nothing found, even no diabetes. Just last month, I have checked each and everything, and he has shown me the whole file and everything. Nothing was there. She says that I feel that I should have a sex. There are many sexual desires in my mind always. But when I start performing, there is no erection, or even little bit erection happens, it immediately fails before coition. And that's why I could not satisfy my wife. And that is a big reason about the quarrels between myself and my wife. And my life is getting spoiled in since last 3 months consecutively. So can you do anything? So I have absolutely disturbed, doctor. I have exhausted from this. I asked whether is there any problem in your private organs. He said no. And then I took the history, but nothing found very specific. Only thing was that his face was quite oily. That's the only thing. And he was exhausted and depressed. Basically, the depression was very marked because of this problem. Then I examined him. And when I examined him, after doing a regular checkup, when I examined, I asked, "Let's check your organs." And then I found that he is having a hydrocele over there along with this. So then I thought this might be one of important feature of selenium. So I worked out the case and I have started him on selenium. I have started giving him selenium 30 in repeated doses for at least 4 or 5 days. Asked him to meet me after 15 days. And I have given along with that a Caliphosporicum for for the tranquilizing effect, relaxation. When he entered in my cabin after 15 days, there was absolutely a different man. The person was completely changed. There was not at all a look about the depression which was there in earlier consultation. And he was willing to confident, and then first sentence which he uttered, "Doctor, you have done the magic in my life." I asked, "What has happened?" He said, "The day you have started medicine, same day I got the very good erections. We had a good coition, good relationship. And thereafter, it worked so normally that it used to happen earlier in my life. And it has changed completely. And now there is no question of quarrel between myself and my wife. And it works so beautifully." So I have not repeated the selenium thereafter. I have continued him of Caliphos for some more months, and I have followed him up to 6 months, and he was remained completely normal thereafter. Such a wonderful remedy for the male problems is the Selenium metallica. So this is very depicting remedy at such a level. Second important thing about the Selenium is that it has many features which we generally overlook. We never think that this is the remedy for the even comedones or acne vulgaris, uh, acne with a seborrheic dermatitis. So I want to share one more case where I have utilized this remedy in a young fellow, again a male person who was just a youngster, nearly about 20-22 years of age, who came to me with a very severe oily face, with a big acne, and along with that scarred acne, the dark blackheads over there. So this fellow entered in my room and he was disturbed because he was taking allopathic treatment for his problem, and which was not working in his case. So he was disturbed because of that. Many local ointments he has used, many fairness creams which he has applied over there. Then he was seen by many skin specialists, and nothing was working. And second important thing, he said this happens not only on face, even it happens in my scalp also. And he was just 20 years of age, and he has explained along with this, "Doctor, one problem is there." And he has shown the patches over there, loss of hairs on his beard. Then he has shown that there are also such types of patches in my hair, scalp also. And then he has shown that, "See my hands, and there were hairs, and also there were the patches of alopecia over there." And he was disturbed because both things were uh, things which are very difficult to treat from allopathic point of view. They have given multivitamins, they have given minerals, they have given iron, they have given calcium, then vitamin E and everything, but nothing was working. And second important thing, they have given many creams, Retino A or etc. for face, and it was not working. Seborrheic dermatitis along with alopecia areata at different places on the body, along with exhaustion, never forget selenium. This is how I have considered the remedy in my mind. So I have started giving him selenium. I have started it with 30 again because this is a good remedy. It bears the repetition. It is 30 is the better potency to start with, and then you can go ahead 201 m. So I started with 30. And because I was expecting result more at the external host layer, at the acne or comedons and seborrheic problem. So I have started with 30 for 3-4 days, and then thereafter I have kept him on placebo and some local application of Berberis aqua mother tincture, nothing more than that. When he came for follow-up after 15 days, lot of change was there in the at the physical level. His acne were much better. Even the scars were much better. So I have continued him on same thing, placebo with Berberis aqua Q. And thereafter, after 1 or 2 months, I have increased the potency to 200. And he was improving day by day. And then he showed, Doctor, patches are lost, gone completely. Alopecia has also recovered with the help of selenium when I increased the potency 201 m. And within 6 months, 7 months, he was completely out of that alopecia problem as well as the seborrheic problems and acne with comedon. This was again a very good result which I have observed with the selenium. So selenium, I used to think like that. It is a remedy, senile remedy. Second important thing, in young phase, if it happens that seborrheic dermatitis associated with the acne and associated with prostration, associated with alopecia, I used to think about selenium, and it is a good remedy to be utilized over there. So we're going to learn it from Allen's keynotes. Selenium, the element. Adapted to light complexion, blondes, great emaciation of the face, hands, legs, feet, and single parts. So here, the emaciation is one important feature which you can look for. This is a remedy from tubercular miasm. So weakness, emaciation, losing flesh while eating well is again common to the tubercular remedies. Selenium is also having that. Very forgetful in business, but during sleep dreams of what he has forgotten. And this is the characteristic symptom of the selenium. This has told to me by many patients their experience. Doctor, I used to forget a lot, and what happens during sleep? I got that. I remember that, and this happens to many people. Headache of drunkards. See, this is very important. All modalities which are very important. Headache of drunkards who used to drink alcohol. After debauchery, debauchery means those persons who never follows the morals, debauchery persons. Headache after lemonade, after tea, after wine, every afternoon. So see, it's very specific remedy for such types of chronic headaches where recurrence is there, and many times it is because of stimulants. Hairs falls off on head, eyebrows, whiskers. Whiskers means beard area, genitals. Coryza ending in diarrhea. See, this is again a characteristic symptom. Coryza, it starts and it remains for a certain period and then it stops and diarrhea starts. Hungry at night, very common feature of CNAP children. The Soranum is one more. Hungry, longing for spirituous liquors, that is stimulants. An almost irresistible maniacal desire. They cannot stop craving. So much craving, so much desire is marked over there regarding these stimulants. Constipation. Here, this comes very closer to the alumina also, aloes also. Constipation, stools hard, large hard impacted so that it requires mechanical aid. We used to keep only two remedies in our mind, silicia and thuja, but there are many more. Aloes is there, then there is calcarea is there, sanicula is there, the sepia is there, silicia is there, thuja is there, and selenium is one more. Constipation after serious illnesses, especially enteric fevers. So see, this is again one of the important feature. Patient who complains of chronic constipation where stools are hard, very difficult to remove, and when it happens after enteric fever, think of selenium first. Urine is red dark, it is scanty, coarse, red, sandy, sediment, involuntary, dribbling while walking. So Involuntary urination, this is a wonderful remedy, specifically when it drops continuously while walking. And one more thing, that this urination is generally red dark. Now the male sexual features, the impotence with desire, lewd thoughts. So this is amorous remedy, but physically absolutely impotent. Sudden impotence is the chlorum. Erection slow, insufficient, too rapid emissions with long continued thrill, weak, ill-humored after coitus, often involuntary dribbling of semen and prostatic fluid which oozes while sitting, while during stool, during sleep, and glit. Glit is a discharge. It is yellowish mucopurulent discharge. Generally happens to be there in, generally in gonorrhea it happens. Caladium is one more remedy mentioned over there. And this indicates that this remedy has a psychosyphilitic miasm, the tubercular miasm in between. Priapism with glands drawn up, testicles drawn up. That sensation is there in priapism. Priapism is long continued painful erections of the penis because of some problems lies in the spinal cord. So there are two different phases. One phase is priapism, second phase is absolutely impotence. Berberis says another remedy mentioned, picric acid is very important remedy for priapism. When it looks that testes are drawn down, then cantharis is the remedy. Aphonia, loss of voice. After long use of voice, husky when beginning to sing, or aphonia with obliged to clear the throat frequently of a transparent starchy mucus like argentum metallicum, like sternum metallicum. Tubercular laryngitis. See, this is remedy from tubercular miasm, tubercular laryngitis. Weak, easily exhausted from either mental or physical labor. After typhoid, after typhus, after debauchery. Irresistible desire to lie down and sleep. See, this is very important. They are so exhausted, prostrated, they want to lie down continuously. Strength suddenly leaves him. Especially in hot weather, the complaints gets aggravated. Very great aversion to the draft of air, either warm, cold, or damp. Draft of air aggravates, whether it is warm, whether it is cold, whether it is damp, but draft aggravates always. So panning aggravates. After typhoid, great weakness of spine, fierce paralysis. So strong weakness after typhoid. This is a wonderful remedy at such a level. Emaciation of the affected parts, that's already we have discussed. Relationship. Compare the phosphorus in genitourinary and respiratory symptoms. That is, phosphorus is very characteristic tubercular remedy, tubercular miasm. Selenium is also from tubercular miasm. Argentum metallicum and sternum in laryngitis of the singers as well as speakers, very close to it. Alumina for heart stools in active rectum. It follows well after caladium, natrum, staphysaggria, phosphoric acid in sexual weaknesses. Each checked by mercurials or sulfur often requires selenium to bring out the cure. Aggravation, general modalities. Draft of air always aggravates. Aggravated in the sun, aggravated from lemonade, that is stimulant, tea and wine. Amelioration from taking cold water or cold air into the mouth. So very important warm-blooded remedy, hot remedy, having very typical features of on male genital system, where you get ample features related with it, but it is not having only action on that. It also have very clear action on the skins also. So at the skin level, there are many features which you can get over there in selenium. So this is a very important remedy in practice. One should read that the remedy has action nearly about 40 days, a deep-acting remedy. Generally, doses I used to use from 30 to 200, commonly 1 m, very occasionally when deep acting, I want deep action. bears repetition well in lower potency. That's why my suggestion is also there. Whenever you are giving in high, then don't repeat it. Then there is no need to repeat. But my suggestion is always to start with low and gradually go up. That will be better in selenium, because this remedy is not having so much of detail proving like other polycrests. And that's why we should be generally cautious while using the selenium. So this is again one important remedy from third year syllabus we have finished today, and then we'll go ahead tomorrow with another remedy. So that's all for today. Thank you being there. If you have any
Thank you very much,
query,
sir.
we can have a chat. Otherwise, we'll finish.
Thank you very much.
Okay. So good night. We'll meet tomorrow evening, same time.
Thank you, sir. Good night.